Yeah, Akshay, you can start.
Oh, is it online screen?
One second. They are to start the. Uh, okay. Okay. Akshay.
Shall I start? Yes. Happy morning. I'm glad to welcome each one of you for joining us for the webinar series conducted by the Department of Psychology, Bharathiyar University, Coimbatore. Now, I request Professor A. Velayathan, Professor and Head, Department of Psychology, Bharathiyar University, to deliver the welcome address.
Good morning to one and all. Hope everybody is safe and healthy. Let me welcome our teachers, Professor Anlakshmi, Krishna, Vinod Kumar, Nitya, and especially our alumni, Mr. Amal Abraham, a wonderful person he was as a student, a dedicated student, loving, fun-loving especially, and also he has spent quite a few uh, experience he has in training now. I was just wondering, all of a sudden when he called me, sir, I would like to volunteer myself to talk to our students, especially person. But unfortunately, the situation now demanded that we will be meeting only in the online, right? No problem. Whenever the situation changes, he will come here also, and I will invite him. We'll all invite him, and also to physically be present here and to give his expertise, show his expertise to us. Mr. Abraham, right? And training, and also,
Thank you so much. Hello. Hello.
yeah, yes, you can continue.
You're audible.
Thank you so much for the warm welcome. I'm extremely happy and I'm so excited today to present and to be a part of this webinar series organized by the Psychology Department of Bharathiyar University. Especially it's, as an alumni student of Bharathiyar University, I'm really honored and privileged to be part of this webinar and to present my topic in front of my teachers. These teachers, they inspired me, they guide me and motivated me, and your inspiration and your guidance that made me what I am today. So I'm very thank you and thank you so much and happy I remember one and all, and especially I'm remember like in the inaugural ceremony our Vice Chancellor, Honorable Vice Chancellor, he mentioned the importance of yoga in today, especially in this pandemic period. He mentioned the importance of yoga in stress management, and I'm very happy you all are be in touch with yoga or the yoga related activities. And especially I would like to thank one of my professors and research scholars in Bharathiyar University, especially our head of the department, Dr. Velayathan sir, and our Dr. Anlashmi ma'am, Krishna sir, and all the research scholars. Their motivation and their guidance that made what I am today. So I think I move on to my presentation, my topic. Uh, yes, I hope it is visible, ma'am.
Yes, sir, it is visible, sir.
Yes, visible, yes. So once again, thank you so much for inviting me to this webinar to present a topic. Today I'm presenting the management of lifestyle disease through yoga. Let me talk about my little about my experience. What I'm presenting today, or what I'm discussing today, it is about my experience in the field of yoga and psychology from the past 2 years. And here I'm usually my presentation things is more on practical oriented. So because through this online platform, it is very difficult to conduct that more practical oriented. So I'm included more on a theoretical and also I'm little a practical oriented class. This is not only a theoretical class; it's also a practical oriented. So you can sit on a chair and you can do the practice or practical things at the end of this theoretical session. So I begin with the session today. These are my contents. And a small introduction. Introduction is nothing but yeah, stress and yoga. I'm included more on stress, not our psychological, full of not full on psychological aspects. It's related with the stress and yoga. It's what the common man facing in the society that I'm introducing here. And after this theoretical session, included a breathing practice for immunity boosting. As we all know that during this COVID-19 situation, everyone, as every health professionals are recommending a breathing practice for your lung capacity improvement or increase the capacity of your lungs. So I'm introducing a yoga technique, a yoga pranayama technique for immunity boosting. And also after the theoretical practice, I'm start with a chair yoga practice. You can sit on a chair and you can start with a stress management program. And also it is diabetes management. Diabetes, it is maybe the students may think it is why that the diabetes management, or they are talking these things to us. But diabetes is one of the now increasing in our especially India is one of the largest in diabetes patients, especially the youngsters. So I'm included a little bit of theoretical information of diabetes management. And also one of the common lifestyle disease issue is the vertigo or ear balance issue. And I'm conducting that practical session for these three: stress management, diabetes management, and also the ear balance issue or vertigo issue also. So I'm begin with the session. So I begin with stress, the concept of stress and yoga. What the stress is a common man, the society, what the society is facing in the case of a stress, and it is related with the yoga. So first, as we all know, stress is not the situation; it is a response necessary to cope with situation. As many of our common people are, there is a misconception that situations, that different situation, that is the stress. Not, it is not the situation is not the stress. It is stress is what the physical response when a situation is occur, especially when a difficult situation, especially like during this pandemic period, we all are in a stressful condition. We are thinking about our future, our financial difficulties, and our other study related difficulties, and all. We know that it is not the stress what our body react, how our physical response and physical and psychological response to the situation is the stress. And we all know that once the demanding situation is over, all the functions return to the normal level. Or that if the particular moment or that situation is changed to another situation, then that stress arousal is it will be come to a normal level. So what the problem here is a persistent, a long-standing situation do not return back to the normal level is our problem. As we all know, like our present situation, a repeated occurring of that particular situation, or our thinking, most of the reason for stress arousal or the increase of stress is nothing but we are our negative thinking, or if a particular situation happen, we are most of our thinking is on negative part. What are the negative aspects of that particular situation? That's our problem, main problem. So the persistent, long-standing situation, that situation is not return back to the normal level. It is again reoccurring that particular situation. So the persistent, long-standing situation is create that stress again and again. And we all know if we don't allow our system to regain its normalcy, that the stress will push again that stress more on stress. Okay, then next I move on to an Adija Vyadi. Adija Vyadi, it's a Sanskrit word. And most of the words I'm using from the yoga text, and it is related to Sanskrit. Here, Adija Vyadi. Adi means we know that anxiety or stress, that psychological thing or that mental things is called Adi. And Vyadi is called due to this Adi, due to this anxiety, we have some certain physical changes. It will happen in our body, in our physical body will subjected to some changes. That is called Vyadi. So Adija Vyadi is our main issue during the stress, during the stressful situation. So we know that several demanding situations we are going through, the several demanding situations that are in when we are look onto our external things in office. We all know that especially during this pandemic period, many of them are struggling with the office related issue. And the family, of course, in the family we know many things are financial management and the relationship issues in the family, and then of course in finance and calamities in the time of during this pandemic period and all. These are the some external situations that are creating stress to the society, especially in this during this time. These are the external things that are creating stress or our physical arousal. And some internal, we look at to look on some internal things, some targets. We know some office workers, they have some targets to achieve, and sensitivity in their character, different is sensitivity and their ambitions, and they are expecting some goals, their expectation to meet the expectation, or the difficulty to meet the expectation. Those are the internal factors to create a stressful situation for a common man. And we all know in modern life, in the modern life, what are the situations we are facing with too many demanding situations. We have too many demanding situations. If it is in the family, if it is with the friends, with the relatives, or with the spouse, there are too many demanding situations that we need to console this whole demanding situation. So once we feel the struggle, or once we feel the difficulty to meet this demanding situation, or to accompany these things, it is create a stressful thing in your life. And also the high sensitivity and sharpness, it's a character. Everyone is unique, and the sensitivity and sharpness is one of the most important thing that is creating tension and targets to be achieved. I already mentioned. And perfectionist and type A character, as the psychology background, we all know what are the type A character style. Perfection is to achieve the perfection or proper perfection. Is the major issue. And also some unrecognized stresses in our modern life. And move on to stress responses. What are the stress responses in psychologically and also physical? Here in psychological, we are facing with the fear, anxiety, and alertness. I think I no need to explain or elaborate about these things: fear, anxiety, and alertness. Those we are experiencing in our everyday life. And some physical changes that we are observing is heart rate and our blood pressure increase. There is an there is a sudden increase of blood pressure and glucose increase. Here I'm mentioning that glucose increase, that made stress, because this I will mention in my another slide, because this glucose increase slowly created this diabetes. Uh, Too many stressful situation that create too much amount of glucose production in our pancreas. So it is create a more amount of glucose in our blood. So there is a chance to develop diabetes at the age of young age, and also the muscle tone increase, as we all know, and it is created a problem in your digestive system, and also the sweating, and also that these are the physical changes and the psychological changes when a stressful situation has occurred. And these are the six enemies. These are the yogic term of six enemies, or the six negative emotions. As a common man, or a common people, we are experiencing. These are the negative emotions. Six negative emotions are the kama, krodha, lobha, moha, and mada, matsarya. These are the lust. We know the krodha is anger, and lobha is miserliness, and moha is infatuations, and mada is arrogance, matsarya is jealousy. We all know these are the negative emotions, as because of our most of our thinking, we focus more on the negative aspects, or the negative part in our life, and more on think on the positive part of our life, or the positive things, or the what are the benefits, what are the abilities, what are the abilities in my life. Instead of that, we are thinking more on the negative emotions, or the negative part of our life. These are the six enemies, or the six negative emotions that are creating a stressful life in our life. And next time, move on to analyzing Sugah. Analyzing Sugah means analyzing the happiness, or what is Sugah, or what is happiness. Most of us think that we focus on object of happiness, or the object of enjoyment. Most of us are happy because when we expect something, or if it is in financial way, or if it is in any other things, it's object of enjoyment. Most of us are hope for, or to get a better thing, or to get a better situation, to get a better life experience. That is object of happiness. Is that happiness is long standing, or if that happiness is permanent? What do you think? I don't think that object of enjoyment it is not long standing. Here we can check one example for the object of happiness. Here I'm there is an animated image. As a child, we know, as a child, he is satisfied with, or he is comfort with a sweet can anything, as a rasagula, or laddu, or a gulab jamun, anything. That child is enjoy with, or he is become more happy with getting, or to collect that things, rasagula or laddu, something. And see, we are repeatedly consuming one after another. Let's take an example of this child, only the child. He is consuming one after another, repeating one rasagula, or two rasagula, and three rasagula. After repeated up to a four or five rasagula, it is creating a slow aversive tendency towards that thing. So what that individual, or what the child is believed himself, or what the child is think about himself, is the object of enjoyment. The end result of that particular object of enjoyment is not that much happy, or end result is not a permanent, it is not a happiness. So the repeated repeated use of that particular thing, or the repeated object of enjoyment, it is not a persistent or not a long-standing happiness. It is not. It will not provide a persistent or long-standing happiness in your life. It's a small example of object of enjoyment. Then we move on to a mind and body relation. It is the concept of yoga. This mind and body concept is a mind and body relation is a yoga concept. We all know the likes and dislike that leads to action. As we all know, we have certain likes and dislike, especially in our interested field, or in the field of our work, or in the field of our study, or if it is related to anything, if in playing cricket, playing football, or working in the field of working or study, anything. As our actions, it's according to our likes and dislikes. If we likes to do that thing, we are very much interested to do the thing within a perfect way. Or if it is we are not like to do that thing, or we are not like to continue that activity, it will make a block in action. So as we all know, that against the right leads to a mental imbalances, like some society rules, some societal rules. If we are going against, or we are performing something against the society rule, or the what the public rule, that will create a mental imbalances. Mental imbalance means it's create a certain anxiety or little tension, or it is a stress. Of course, it is create a stress. So the prana flows become imbalanced in our body. I'm talking about that some yogic concept. Prana, as we all know, that prana is flowing through our nadis. Nadi means not our veins. These are the invisible channels in our body. It's like a very small. These are not visible through the thing or microscope or anything, or through the scan or anything. These are the invisible channel that we believe our prana vayu, or the prana flow is flowing through the nadis. It is believed that there are more than 72,000 of nadis in our body. So the pranavayu is flowing through these nadis. When the our body, or the some physical imbalances happen, or some psychological imbalances take place, this prana flows become imbalanced, and the pranavayu, that smooth flow of the pranavayu, become in an imbalanced condition. So it will create some digestive problem, digestive issues, like that pranavayu. If the pranavayu is flows properly through the prana nadis, then only that our all the functioning of our body, if it is related to the blood circulation, if it is related to lymph circulation, if it is anything, that prana flow, or the prana nadis are controlling these all physiological function in our body. So what will happen if the prana flow become imbalanced is it is caused to some digestive problem. Digestive problem, here I'm mentioning that three Sanskrit words. These are the kujirnatam and ajirnatam and adijirnatam. These are kujirnatam means very no digestion. Kujirnatam means no digestion, means less digestion. Sometimes this prana flow become imbalanced. It will lead to a no digestion in our body. That we all know. We all know what are the further after effects of digestive system become imbalanced. And also this one more other problem, ajirnatam means is a less digestion, or it's a state of less digestion in our body. And also the adijirnatam means the way it means over digestion. If as we all know, the some in psychology, we know according to the stress, our body is reacting in a different way. Like our digestive things will over digestion, sometimes very less digestion, sometimes no digestion. This all will create some physiological problem, or physiological other diseases in our body. So this is the mind and body relation according to the yoga concept. This is the mind and body relation, how the changes in our mind, how the changes in our psychological aspect, how it is leads to our physiological change, how it is lead to the physiological problems in our everyday life, or what the common man is facing in his day-to-day life. So the disease progression, I'm mentioning again a yoga concept, stages of Adija Vyadi, stage 1. I already mentioned Adija Vyadi. Adija Vyadi means psychologically, a psychological issue, the psychological problem leads to the physical problem. That is Adija Vyadi. How it is progressing, or how it is affecting. We know it is mostly it is affected our Manomaya Kosha. We know that Panja Koshas, or the different koshas in our body. These are the Annamaya Kosha, Pranamaya Kosha, Manomaya Kosha, Vijnanamaya Kosha, and Anandamaya Kosha. These are the 5 sheath in our body, or the Panja Koshas in our physical body. So this stressful condition, or this anxiety or the stress, the psychological issue, it is affected, mostly it is affected our Manomaya Kosha. Manomaya means, mana means manas, or our mind. Manomaya Kosha become imbalanced. And what all are the further problems it is that lead to insomnia? We all know that some sleepless problem, restlessness. We know we are not comfortable in our day-to-day life, day-to-day situations, and irritability. Of course, we are not. We are become more reactive to everything. We are more reactive with every situation. Nothing can satisfy in our that present situation, and also it lead to some emotional outburst. So the problems in psychological thing, or the changes in our psychological thing, that will affect our Manomaya Kosha. And this is progression. This disease progression is, maybe it is start with insomnia, some sleepless disorder, some sleep issues. So it is slowly move on to slowly the disease is progressing. That Adi is slowly move on to the Vyadi. How it is? It's restlessness, starting with some restlessness, some irritability, a few of anxiety related things. Then it is start to emotional outbursts. It is then it is move on to a physical thing. That is the mind and body relation. Mind and body, how the mind is, how the psychological issue is lead to the physical issue, or the physiological issue. And this is the disease progression, how the disease progressing from mind to the body. And how do you respond to the stress? Is our response to the stress leads to little more problems in our life? Are your response is positive or negative, or are you a person look into yourself, or introspect yourself, like are you a proactive person or a reactive person? Try to be more proactive than a reactive. Be think before you perform anything, or before you act anything. So suddenly, or simultaneously, when a stress comes, when a stressful situation is come, be just take a moment to think, and be more proactive than a reactive person. So Hans Ellis is one of the psychologists. Says once, it is not the stress that kills us, it is our reaction to it. It is not the stressful situation, or it is the stress in our body, that what we call the psychological stress or physical stress, that is not create any harm, or that is not create any problems to us. It is our reaction to how we are taking, or how we are taking that thing, how we are observing, how we are maintaining, and how we are reacting to that particular stressful situation, that create problems, that create further issues in our life. And of course, this bell cycled car, this diagram, we can look at this diagram. I hope it is visible to all. We all know that how the stress and performance, it's a performance and stress graph. When we are in a low performance, when we are not performing as much, we are in a sleepy mood, or not much stress. We are in a very sleepy mood, and slowly, when the performance increase, it is lead to a slow alertness, and an optimum level of performance is lead to, and we need an optimal level of stress also for a perfection, or to complete a particular activity. If it is anything, if it is in the time of examination, if it is anything related to the job, or some targets to be achieved, if it is in the family, we need a optimum level of performance, and also we need a optimal level of stress is a basic physiological thing in our life. We all know a little amount of stress is needed for a better performance, but it should be an optimum level. That is the bell curved graph is now showing here. An optimal level of performance and optimal level of stress is for the perfect outcome, or the perfect outcome, or perfect result in your every activity. If it is in study, if it is in examination, we need a little amount of stress. Then only we are our physiologically and psychologically be more aroused, and we can perform it is better way. Or what the condition when the stress is too over, when the stress is too high, what will happen in the stress is too high, then it is slowly from the optimal level, it is slowly created an anxiety. The situation is changed from the optimal level of performance to the anxiety, and it is lead to a disorganization, and it is lead to a more stressful condition. That we are, as a psychology student or research scholars, that every day we are going through this graph. I think is a very familiar graph for you all. So for the common man, I'm explaining much about this thing. We need a certain amount of stress is very important, but it should be an optimal level. More than that optimal level, or more than a certain amount of certain amount of that stress, it lead to anxiety, it lead to some form of depression, and it lead to other psychological problem, and also the physiological problem. I hope that is clear. And what are the after effect of that problem when we are more into that more into that stressful condition? These are the physical changes that is happening in our life. So these are the muscle tension. We all know muscle tension. Various muscle tension, we become more, our muscles have become more rigid, and our neck muscles and our facial muscles, and eyes become more wide and open. There are many issues like raising our voice, and irritation, as I already mentioned, and inability to sleep. Some people, and especially that if you are in a situation of stress, you can't sleep and much, and also excessive tiredness. Our body become use more of this glucose. Our cell function is more, so the our body using, or cells are using more of glucose in our body. So we feel excessive tiredness and dry mouth, of course, some breathing difficulty. We know our breathing pattern. I already mentioned how the prana flow become imbalanced in this stressful condition. So when the prana flow become imbalanced, our it affect our nadi flow, or the prana flow in our nadi. So it is creating a problem to our breathing difficulty. Of course, then a sweaty palms. Of course, a sweaty palms and cold hands and stomach upset. Stomach upset is one of the common issue related to this stressful condition. And I think that stomach butterflies, and anything that a feel of some issue, a feel of some problems, a repeated issues in your stomach. It lead to, of course, it is lead to some digestive problem. It lead to your food habits also. It lead to some problems in your food habit. You may eat more, or you can't eat more, something like that. It is lead to the stomach upset, lead to that other things, digestive problem. And we move on to some, what are the emotional and mental symptoms during this stressful condition. These are the anxiety, worry, guilt, nervousness, anger, frustration, moodiness, depression, and suicidal thinking. Of course, it is too much stress in everyday situation. Too many stressful situation, or too many stressful situation in the case of from the external situation and also internal situation. It is mainly during this pandemic period. We all know we are struggling more with some external stress causes and also some internal. We are in lockdown. In this lockdown period, we are not able to. Most of them are not able to work properly, and some, of course, it is lead to some financial difficulty. So, as we all know, several studies are going on about that suicidal thinking. Why these individual are lead to this stress is lead to suicidal thinking. Is, of course, it is a repeated stressful condition. It is not that stressful condition. Now it is not changing from our everyday life. It is one after another. It is repeating in our life. So it is lead to a suicidal thinking. That is our related to our negative emotions and appetite varies. Loneliness, of course, we feel loneliness. It lead to this suicidal thinking. Nightmares and diminished concentration, and it is lead to an attention and concentration problem when our physiological and psychological arousal and physiological and psychological problems happen. It is lead to a concentration issue, and it is lead to impaired memory or forgetfulness. That it affect that our thinking process or our memory. It will affect, surely it will affect our thinking process or our memory. So these are the emotional and mental symptoms is associated with the stressful condition. So behavioral changes, as I already mentioned, these all change in productivity. Of course, it is lead to the change in productivity, especially in the case of a student and during the time of examination. We know maybe he's a well student, or he is performing well before this examination, or during the class hour, or during his study period. But during the time of examination, maybe one after another, some stressful situation, or some stressful situation from the family, or stressful situation within his life, that have a change in productivity. It will lead to a change in productivity in his behavior pattern. So it may affect his performance in his examination. If it is not, as an example, I'm taking this examination part as a student. So the too many demanding situation, or too many stressful situation, that create a change in productivity. Sleep disorder, we already mentioned. Change in eating habits, and serious appearance in the sense we are not satisfied. We are not uh, performance wise, or in psychological ways, or we are not much happy in our present situation. That happiness, that our usual happiness is not there. Not, we can't observe the usual happiness in the appearance, our serious appearance, always our serious appearance. And nervous behavior, always we are in a distracted thinking, or in a distracted way of doing something, distracted way of we are performing something, and that is created a nervous behavior. Increased frustration, that's of course is a part of stress situation. Increased frustration is increasing one after another. And overreacting, this is the term, overreacting. That's why I told just before, it is you become more proactive, think more on what will be the outcome, or think more on what will be the future outcome of that particular thing. Or if I'm performing like this, or I'm performing like that, what will be the future outcome? Just a thing, just introspect yourself before to perform anything, or to before act something. That is, most of them we are performing as a common man, everyone. If it is a teacher, or a student, or a scholar, or anyone, we are performing in the during the stressful situation. We are overreactive. it is some involuntary changes in our psychologically or physiologically. Some involuntary changes is also happening that create an overreaction. That overreaction never a happy end in our life or a happiness in our life. And it lead to a behavioral changes that lead to increased consumption of alcohol and many more. And people those are common people, those they are finding their happiness in using this alcohol consumption and all. They think themselves as this consumption of that alcohol or other things or other thing that create more happy, but actually it will create more problems in their psychologically or behaviorally. We all know that what are the symptoms or what are the changes happening in during the alcoholism or the patient become an alcoholic, and or these are the behavioral changes that is happening in during the stressful situation. So next, move on to diabetes part. These all are about that stress and yoga or a stressful part. I think it is we can move on to a pranayama part, a small practical part, a practical oriented session now for a stress management or a stress relief technique. So let me start with a pranayama technique. Pranayama technique is a practical. It's a practical oriented time. It is called Nadi Shuddhi Pranayam. Nadi Shuddhi Pranayam. What I am suggesting to the person who are in a stressful condition or he is in a more not in the time of anxiety. Some of them are performing this pranayama and all. They are in a stressful condition. It is a wrong practice. It's a wrong thinking that if you are in a stressful situation, if you are in a very difficult situation, don't do any pranayam, because it is not for at the moment of stressful situation. You should practice in every day. It should be a habit in your life. Then only that you can control. You can be more proactive in your life. What are the benefits of this pranayama? We can check. It's a universal practice without any contraindication. So everyone can take part in your family. If you are observing, anyone can take part in this pranayam. In your family also, you can suggest your family members also. You can suggest to take part in this pranayam. So what are the benefits of this pranayam? It's promote a balance between sympathetic and parasympathetic nervous system. We all know the sympathetic and parasympathetic nervous system. One is stimulating involuntary function, and one is diminishing the activity. That we know that what are the sympathetic and parasympathetic nervous system is the role of parasympathetic and sympathetic nervous system in our body. So this pranayama, through this pranayama or repeated practice of or within a prolonged practice of this Nadi Shuddhi pranayam, you can create a balance within this sympathetic and parasympathetic nervous system. And of course, it is reduction in anxiety and your stress level. So I think we can move on to this pranayama. So I think I can stop this presentation thing, and move on to this screen view. Hello. Hello, Akshay ma'am.
Yes, sir. We can see you, sir.
Hope my screen is visible.
Yes, sir. Yes, sir. We can see you.
Yes. Before move on to this practice, we can sit on a chair. Everyone, you can sit on a chair. Everyone can take part in this. Take part in this pranayama thing. Okay, it is better to sit on a chair with your back should be straight. There are some preparation is needed before you start this pranayam. I think my screen is visible to all. Yes.
Yes, sir, we can see. Yes.
Ma'am is visible. Yes, yes, yes. Yes, you can sit on a chair. You can sit on a chair. You can sit in straight. Sit. Yes, sit in. You can sit in straight and yes. Be relax you, more relax you. Just slowly you can breathe in and you can breathe out through the nose. You can breathe in and breathe out through the nostril. Very slowly you can breathe in and breathe out. Breathe in and breathe out. Very slowly breathe in and breathe out. Breathe in and breathe out. Relax your body and relax your mind. Relax your body and relax your mind. Please remember, you should practice this pranayama in every day, and you can perform this pranayama in every day. It's a morning or evening, up to your convenient time. Before half an hour before. At least one more thing is half an hour before your food intake. You should not perform this pranayama immediately after this food intake or immediately after eat. Okay, then we can sit in relaxation. We can sit in relaxation. We can focus on our inhalation and exhalation. Inhalation and exhalation. Focus on our inhalation and exhalation. So slowly you can close your eyes. Close your eyes. Focus on your breathe in and breathe out. Focus on your breathe in and breathe out. Your back should be straight. Your lower back and your upper back should be straight. Breathe in and breathe out. 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 Relax your mind and relax your body. Very slowly take a deep inhale on. And very slowly you can exhale. No physical movement, no other body movement, no shoulder movement or your chest movement. Just slowly focus only on your breath. Inhale and take a deep inhale and you can very slowly and deeply you can exhale out. Yes, hope you are relaxed, your body and your mind also relaxed. You can open your eyes. You can slowly open your eyes. Yes, this is, I'm performing Nadi Shuddhi Pranayama. Nadi Shuddhi Pranayama, I already mentioned there are more than 72,000 of nadis in our body. So this pranayama is for refreshing, or it is more alerting, more stimulating our nadis in our body. So we can use our right thumb. You can take your right thumb in your right palm. You can take your right thumb and you close your right nostril. You can close your right nostril and you can use your ring finger. You can open your ring finger and your little finger. Hope it is visible. Hope it is visible. Yes. Actually, ma'am, you can come. You can your video. Please you switch on your video, and I can instruct if I'm okay. Yes. Take your right thumb and close your right nostril with your ring finger and your little finger. With your ring finger and your little finger, you can open. Okay. Now we are inhaling through our left nostril. Okay, very slowly we are inhaling through the left nostril. Inhaling, and then after inhalation we are close our left nostril with our ring finger and we are exhaling through the right nostril. Very slowly exhaling through the right nostril. After exhalation, we are inhaling through the right nostril. Inhaling through the right nostril. And with your thumb again, close your right nostril and you can exhale through the left nostril. Yes, this is one round of Nadi Shuddhi Pranayam. Okay, we can practice like you can inhale through the left nostril. and you can close your left nostril with your ring finger, and you can exhale out through the right nostril. Yes, you can again inhale through the right nostril. Close with your thumb and exhale through the left nostril. Yes. Yes. Again, continue. Hope you get me. Actually, ma'am,
Yes, sir. We
hope it
can
is
see. Yeah, the instruction.
instruction is proper. Yes,
Yes.
yes. You can continue. You can continue. You can sit in straight. Always sit in straight. Relax your body. No need to your shoulder also. Relax your shoulders and your hand. Here you can elbow. You can elbow. You can touch with your chest and your elbow. You can touch with your body and relax this hand also. You can very slowly and your up to your flexibility. You can inhale and close with your ring finger, and you can exhale out through the right nostril. Yes. No need to hold your breath. No need to hold your breath. You can inhale, and immediately after the inhalation, you can exhale out through the other nostril. Okay, now close your eyes and continue this practice. You can close your eyes and continue this practice. Close your eyes. Sit in comfortable. Yes, very slowly take a breath. Take a deep breath. Inhale and look into yourself. Yes, focus on the change in your breathing pattern. Focus on the change in your breathing pattern. Yes, very slowly, like a flow. You can inhale, and yes, after your inhalation, you can exhale out through the other nostril. Again, inhale through the particular that same nostril, and you can exhale out through the other nostril. Yes, it is like a bell shaped curve. We can like inhale and exhale to the other nostril. Then from the inhalation and exhalation, like a bell shaped curve, we can inhale up and you can exhale. You can practice if you want more of this benefit, or if you want to practice more, you can in my same I'm conducted many pranayama practices for different health issues in my Facebook page. Same, you can search on Amal Abraham on Facebook page, and conducted many pranayama related to this stress management. Or this is one of the best, and this is one of the best recommended pranayama by all the doctors for anyone. If you are in any health condition, or if you are in any health issues, you can practice. Instead, if those who are having any asthma related issue, those who are having any serious lung related issue, those people, you should consult a doctor before practicing this pranayama. But through the practice of this pranayama in every day, it should be a practice in your life. Then you can be more proactive in your life after repeated. I'm not talking about within 1 day or within 2 day. You can't achieve this thing, or you will not get the benefit of this thing. Throughout the practice of a 2 week or a 2 week period or a 1 month period, you can surely you can observe the change in psychologically, and also the physiologically. You can feel the change in your body. Okay, this is about the stress management, or a therapeutic approach of stress management in through the yoga practice, or the pranayama practice. Then let me move on to presentation again about the diabetes related thing. Ma'am, hope it is visible.
Yes, sir.
Yes.
Can I make it as a full screen?
Yes, yes, 1 second. Yes.
Yes, sir.
Hope it is correct.
No, sir. Can you do it again? Because
Okay, 1 second. This is visible.
Yeah, but then it's like shrunken form. It's not like the full form.
Okay, 1 second. Hope this is visible.
This one is kind of fine, sir.
Okay, okay. I don't know why it is. That horizontal view is not.
Yeah, it's not coming as full screen. I'm not sure why.
Okay. Hope now it is visible.
Yes. Yes, now it is clear, sir. Yes.
Now it is clear, right?
Yes, yes, sir.
Yes, yes, yes. Yes. Okay. We move on to diabetes part, diabetes mellitus, and the importance of diabetes. As I already mentioned, due to the overstress, due to this stressful situation, it is create or it is change in a physiological change, like more on glucose production. I already mentioned the glucose increase, the increased production of glucose that lead to the diabetic condition, and especially before earlier this diabetic thing is affected only at the age of 30 or more than above 30 35 years of age, but now it's a very common in youth youngsters, the age of after the age of 20 or 25, it is diabetes is most common. I think the one of the reason is stress. One of the most common reason, not one of the reason, is one of the most common reason is stress management. The difficulty to manage your own stress is causing the diabetes. And we look on to some basic information or very basic medical informations about this diabetic things. We know that this name is derived from the diabenos, two words, diabenos and mellitus, two Latin word. It's a fountain and sweet. Uh, from that two Latin word, it is this word derives diabetes mellitus. And diabetes mellitus, as we all know, it's a group of diseases characterized by high level of blood glucose resulting from the defect of insulin production or insulin action or both. We all know that diabetes is the condition is nothing but the increase of glucose. The level of glucose is increased in our bloodstream or in our in our blood. So it may because of the insulin production or defect in insulin production, or it is because of the insulin action, or both can together happen. According to that, this insulin changes or the insulin deficiency, we changes this diabetes into type 1 diabetes and type 2 diabetes. I will uh, explain more about in upcoming slide. Before that, we move on to some World Health Organization statistics about that diabetes. India is going to be the global capital of diabetes in 2025. The studies revealed that that in the year of 2000, there are 3 crores of people in India. They are affected with the diabetes issues. But it in later, but the studies have shown that it is in within 2025. I think no need of 2025. Before 2025, we are expecting 8 crores of that much progress or that much increased in the number of people those will affected with this diabetes issue. So 1 in every 5 diabetics in the world is an Indian. That is the statistical conclusion of diabetic things. On in every 10 seconds, a patient dies of diabetic problem. That is the World Health Organization as a reporting as of now. And we can go through the glucose balance. What is the glucose balance? How it is glucose balancing in our body? We all know the source of energy for cell functioning. Glucose is very essential for the cell functioning. It's a source of energy in the organ. We know in the organ pancreas that insulin and glucagon that are the hormones that decreases and increases the blood glucose level respectively. Insulin is controlling our blood glucose level. So it is maintaining. There is a maintaining that it is maintaining that blood glucose level properly in our bloodstream. We know that these are the two alpha cells and beta cells in our pancreas. Alpha cell is responsible for glucagon producing of glucagon, and the beta cell is responsible for the insulin. And also the beta cell is functioning. One more function is glucose into cell. Beta cell is helping the transmission of glucose into cell, transport of this glucose into cell, and also the insulin production through the insulin production. So we move on to types of diabetes, or different types of, not different type, type 1 and type 2 diabetes mellitus. How it is affected an individual. In type 1 diabetes, was previously called insulin dependent diabetes mellitus, IDDM, or insulin dependent diabetes mellitus, or juvenile onset diabetes. In type 1 diabetes, what the type 1 diabetes is, it is developed when the body's immune system destroy the pancreatic beta cell, the only cell in the body that make the hormone insulin that regulate the blood glucose level. So in type 1 diabetes, it is that's why it is called juvenile onset. It is maybe with the birth of through the birth of a child, this may happen, because in the time of birth itself, that our pancreatic that beta cell is not functioning, or the that our body's immune system destroy the pancreatic beta cell. So there is no insulin production is happening in our body. No insulin production. So only the glucose. So the pancreas is only producing that glucose, not producing any insulin. So the glucose level in the blood remain a high level of glucose level is maintaining in the blood. So what we do is we need a insulin injection for those individuals. Need a lifelong injection. I'm suggesting. I'm telling about the type 1 diabetes. The people who are affected with the type 1 diabetes, those people need a lifelong insulin injection to maintain the blood glucose level, to reduce the glucose level in your bloodstream. And this form of diabetes usually strikes children and young adults. And although the disease onset can occur at any age, it is very rare and happening at a different time. It is usually strikes with small children and young adults. So it is a physiological problem. It's a physiological problem in our body, on our pancreatic organ, that is no insulin production is happening. So the glucose level is high. Though the type 1, they become a type 1 diabetic patient. This is type 1 diabetics, and we move on to type 2 diabetes mellitus. Type 2 diabetes mellitus was previously called non-insulin dependent diabetes mellitus, or NIDDM, or adult onset diabetes mellitus. This is the 90 to 95% of people who are affected with the type 2 diabetes, because this type 2 diabetes may account for about 90% to 95% of all diagnosed cases of diabetes. This type 2 diabetes is also seen in young adults now, that youngsters after the age of 20. Now it is most commonly seen is in the after the age of 20, 25. It is this type 2 diabetes is diagnosed in youngsters. It is one of the most affecting reason is because of the stress. It is usually begins. We can check how this type 2 diabetes, how the type 2 diabetes happening, what the medical condition is in the type 2 diabetes. It usually begins as insulin resistance. It is here. It is not in. We know that in type 1 diabetes there is no insulin. There is no production of insulin as in our body. So the glucose level is increased. In type 2 diabetes, insulin is producing. Insulin is there, but the insulin resistance, or the insulin action, insulin is not acting properly in our body. So because of the inaction or the resistance to perform properly the insulin, the glucose level is remaining high. We can check how it is. A disorder in which the cells do not use insulin properly. As the need for insulin rises, the pancreas gradually loses its ability to produce the insulin. That pancreas ability to lose, that loss of ability in pancreas to use that properly, perform that pancreatic beta cell. If pancreatic beta cell is not performing properly, that's why that insulin is not acting properly. So type 2 diabetes is associated with older age, obesity, family history of diabetes, a family history or the hereditary. It is a hereditary change, the diabetes. So of course it is diagnosed in youngsters. So we can check this type 2 diabetes with the help of a diagram. What the abnormality is happening in the insulin inefficiency. Not there is no insulin is producing, but the inefficiency of insulin. It is called sleeping gatekeeper of cell. Sleeping gatekeeper. We can from this picture we can observe that insulin receptors. There are green color, two green color strand, and that violet color are insulin, and the white color is glucose. When the insulin is attached with the insulin receptors, then only the cell will accept the glucose. That is the insulin activity. Insulin, the work of insulin or the duty of insulin is to attach with the insulin receptors. When it is attached properly to the insulin receptors, then only the glucose, you can see the right end, then only that insulin will enter into the cell, or it is very flow. The flow of insulin intake will happen properly through the insulin, through the glucose transporters. If what the problem is, you can see in the picture, there is a defect in the signaling of GLUT4, or defect in signaling, or that is called a sleeping gatekeeper of the cell. Their insulin receptors are not acting properly. So the entering of glucose is not properly happening in our cell. So what will happen? That blood in the glucose level in the bloodstream remaining high, because insulin is also producing insulin. It is like you can consider it is like a flow of insulin and glucose together to the bloodstream. After producing insulin and glucose together to the bloodstream, it is flowing together. Glucose and that insulin is flowing together, but insulin is not attaching with the receptor. What will happen? The glucose, the amount of glucose become more and more in your bloodstream. So even the case, this is a normal case. Even the case of a stressful condition, or the common man, or anyone, if it is a teacher, or if it is a student, or anyone, if you are in a stressful condition, our body will produce more glucose. So if you are a patient with the type 2 diabetes, insulin is not taking proper action, but during the stressful condition, more glucose is producing to your bloodstream. So what will happen? The end result is, or the eventually the end result is, it is guide to, it is lead to that diabetes is increased, or the diabetes become more increased, or the glucose level remains high in your blood. So the type 2 diabetes is nothing but the insulin resistance. Insulin receptors are not acting properly. That is the type 2 condition is happening. Then we can check through the causes of other causes of this diabetes. It's a hereditary. We all know that it is a chromosome 6, defect in chromosome 6. It's lead to this diabetes related issue, hereditary. It will pass from one generation to another generation. And of course, obesity. Obviously, no need to describe more on obesity. You can look at this picture. There's a pulse related things, and more protein related food. Consume more protein related food, and lunch also. You can decrease the amount of food intake in a day. From breakfast, you can eat more, and in lunch you can eat less, eat little less, and in dinner you can have it a little more. So you can control the obesity. You can, without a proper diet, without a proper food controlling, you can't reduce the weight in our body. Only through the exercise you can't reduce with a proper diet is also important in any practice. If you are going to gym, or if you are performing yoga, if you are performing any activity, you need to control a diet in your everyday life. And of course, a concept of stress. I already mentioned very detailed about this concept of stress. We all know as the stress increases, the glucose level is also increased. And then bad habit that procrastination is what is happening in these days. It is a very as a fun picture. You can who we are fat, what do we want to start our diet and exercise. Okay, when do we start? On Monday. Oh, today is Monday, or next Monday. In every week there is a Monday. So, or the tomorrow, there is a endless tomorrow in our life, in every day. It is in every health and fitness field, especially in our yoga. From my experience, in every month, the beginning of month, the first of every month, there are more than 5 to 6 admission for my yoga practice in my clients, on my for my students. Within 1 week or within 2 weeks, they will drop their practice. And especially you can in the new year, as a new year resolution, you may be familiar with the new year resolution. Okay, I will start my gym practice, or I will start my yoga thing from the first day onwards, 1st January onwards. Within 1 week, they will drop. Most of them are drop their practice of exercise. Those will practice, those will not too much encouraged or too much motivated than before. It is our bad habit. Try to be more focused on a healthy way, healthy diet and healthy exercise way. And here I am. Uh, Here I'm starting with why yoga. Why yoga? The importance of yoga. Now I'm move on to importance of yoga. Before that, I move on to one more uh, breathing practice, or one more practical session. Now, it is nothing but a diabetic controlled. Uh, I think I can. Yes. Hope my slide is visible, ma'am.
Yeah, again, it is like in the chat. Yeah, now it is clear.
Now it is clear, right? Yes. So yoga in diabetes, how it is. So that picture is it's a technique. It is called it's in yoga. It is called Uddiyana Bandha. It's a negative suction pressure in your abdominal cavity. It is for increasing the pancreatic activity. It is that we are not practicing now. It is a little difficult yoga technique to practice. This video also I uploaded in my Facebook page. If you want to visit more on this practice, you can visit my Facebook page. I explained that how it is performed, and the video, including that video, I already uploaded in my Facebook page. So here I'm mentioning how the yoga in diabetes, how the yoga technique can help in a patient with a type diabetic, especially a type 2 diabetes. I already mentioned type 2 diabetes is happening because of the insulin resistance, or insulin inefficiency, or the pancreatic beta cell is not performing. Pancreas is not performing well. Pancreas is not stimulating. There is no much stimulation in your pancreas. Because of that, is insulin inefficiency is happening. So in through the yoga technique, what we are conducting is, or what we look into that, the pancreatic activity, the stimulating of the pancreas through the repeated stimulation of pancreas, and the repeated stimulation and the deep relaxation method. Your pancreas activity, your activity in your pancreas become more and more. It will increase. So the production of insulin can be more, and the pancreatic beta cell can be perform well, function well, and it can control your blood glucose level. That increased amount of blood glucose level you can control in our body. Okay, let's move on to what are the different yoga asanas we are providing during my session, during my therapeutic session to my clients. These are the Ardha Matsyendrasana and some Dhanurasana. Many of asanas are for this diabetic management or this diabetic management therapeutic approach. Here we are actually that what the scientific method behind this is stimulation and deep rest. Stimulation of your pancreas and providing a deep rest. Yoga is nothing but stimulation and relaxation, or the stretching and relaxation. That is the yoga. That is through the yoga technique. Deep rest. What the benefit through this exercise or a breathing practice is, deep rest improves the beta cell efficiency. Through the stimulation and through the deep rest, the beta cell efficiency become more improved. So now I'm move on to one practical session. Practical session now. It is a breathing. You can sit on a chair and you can breathe this thing. I think, ma'am, can you open this window for a practical presentation?
Sorry, sir.
One second. I want to present this. Hope I'm visible.
Yes, now we can see you, sir.
Yes. Again, now we move on to one simple breathing technique to increase your pancreatic activity. Ma'am, please stay in your video. Okay.
Yes.
Here you can again sit on a chair and you can be straight, sit in straight. This is one of the breathing practice we are providing during the time of the diabetic management therapy through the yoga. I'm providing is a basic breathing style, or a basic breathing to the stimulation or stimulation of your pancreas. So stimulating your pancreatic activity. Or this is like this. It's a simple breathing. You can sit in, relax and sit in straight and breathe in and breathe out. Everyone can take part in this practical session. You can sit on a chair, and recommending try to sit in straight and be ready. And here we are through this breathing practice, through this breathing style, we are planning to stimulate our pancreas. Pancreas, we all know it is the pancreas situated in this right at the beginning of our at the end of our this ribs part. This pancreas is situated on the right hand side of our this abdominal area. So we are providing a pressure with our breathing. We are providing a pressure on our pancreatic area, and we are stimulating our pancreas through the breathing. Only through the breathing practice only we are performing today. Okay, you can with your left hand, you can make a fist in your left hand. You can make a tight fist in your left palm, and your left palm you can little inhale, and then you will get a exhale, and yes, feel the palm pressure. Feel the palm pressure on your this right side of your abdomen, means that pancreatic area, and try to stimulate your pancreas. It is more, you can stimulate the pancreatic activity. So this breathing practice can practice everyone except those having some disc issues, those who having some back issue. Those please do it very slowly. Others, you can continue this practice. Try to do it three more time. Hold your right hand here. Take a deep inhale, and with your exhalation, yes, feel the pressure on your abdomen. Inhale, and take a deep inhale and expand your abdomen, and with your exhalation, exhale, and one more, take a deep inhale and stretching, expand, and with your exhalation, exhale. Yes, we can, as a beginner, you can continue with a 10 round in it at a time. You can continue it in a 10 round of practice. Later you can slowly increase. This is a basic breathing practice you can perform at any time. Means before food, you should take some preparations before food, and after food you should maintain a 1 hour gap. Then only you should perform. With a full of food, you should not practice this thing. With a empty stomach, you should try to practice this thing. Try to this also, like our earlier Nadi Shuddhi, Pranayama. Try to practice this also at anywhere, at any time you can practice it. It's in your office, during your driving, or driving means during your traveling, or at your office, or in the school or college. At anywhere you can practice a simple exercise. Simple exercise you can stimulate your pancreas, because you are every day you are stressed too much, or worried too much because of many reasons. So you can practice in a repeated practice in every day. That you can help you within a repeated practice or prolonged practice of this thing. You can make a change. You'll get a change in your body. You can observe the change within yourself. Okay, this is the basic practice, and I'm not going to any further practical session of this thing. And I'm conducting online sessions for this diabetes management, and also stress management yoga. I'm conducting. You will get more information in my Facebook page, or you can contact me directly for more if you need any more information about this diabetes management. And let's move on to my presentation. I need to cover one more aspect. It is related to vertigo or ear balance. This is also one of the most common lifestyle disease in this thing. Okay, and again I move on to presentation. Ma'am, hope it is visible, right?
Yes, sir. It's very clear.
Ma'am, our time limit is 1 o'clock, or
Yes, it is 1 o'clock. We can finish it
okay.
in 10 minutes.
I need to go through a little more slide, but I will go a little more faster. Okay. Yes. Then why yoga? The importance of, I'm starting with the importance of, I'm not talking much theoretical about this yoga. We already practiced a little about the yoga thing. And I'm talking a little about the yoga. Why yoga is important during this condition, or during this pandemic period, or yoga in everyday life. It's a journey toward a healthier and a happier life. Then we move on to what is yoga. Most of them consider this yoga as it's a asana, only the practice of asana, or only the practice of breathing practice, or only the meditation. What do you think? This is not yoga is not a limited or yoga is not any asana, only the breathing practice, only the meditation. It is a lifestyle. Yoga is a lifestyle. I want to explain it like it's like Buddhism, or it is like that Christianity, Hinduism, and it is like there are different laws and different rituals and different rules and regulations in a particular every religion. It is yoga. Yoga is like a separate entity. It is not under any religious thing, or it is not under any particular the platform or nothing. Yoga is a lifestyle. If there are certain rules and regulations in yoga, and this asana and meditation and this pranayama, these all are the part in this yoga. Actually, there are 8-fold path, or 8 stages in yoga. That is the rules and regulations, and comes under the first 2 stages of yoga. There are 8 stages of yoga in the yoga life. It is yama, niyama, asana. Then comes only asana. You should follow the rules and regulations of this yoga life. Then only you should move on to this asana. Then comes this pranayama. After asana, you should comes pranayama. Then pratyahara, dharana, and samadhi. Dharana, dhyana, and samadhi. These are the 8-fold path, or the 8 stages in yoga. There are rules and particular rules and regulations, and in yoga you should follow a path in yoga. You should follow this path. It's a lifestyle, not I don't want to conclude the yoga within asana or include this yoga only. It is only a meditation, only a asana. No, it's a holistic approach. It is considering all aspects in our life. There is a certain rules and regulations in yoga. If you're following, it will physically and mentally you can improve more in your life. And I'm not talking much about this yoga thing. We can go through some definitions of yoga. It is definitions as related with some psychological aspect. Patanjali said it is a state of mind free of vrittis. Vrittis means distraction. Patanjali in his Yoga Sutra, he mentioned as it's a state of mind. Yoga is a state of mind, free from distraction, free from all the disturbances. And Yoga Vasishta. Vasishta Muni is said that it's like a method to calm down the mind, a method to mind become more relaxed. That is Yoga Vasishta. And in Upanishad, we heard about Upanishad. There are different Upanishads are there in our life, like Kadopanishad, Manduga Upanishad, and Taittiriya Upanishad. Different Upanishads are there. And in Kadopanishad, it says that it is a state of a steady mind and mastery over senses. And there's a mastery over our these things, our psychological thinking, negative emotions, and everything. It is a state of a steady mind. We are focusing only on a particular thing, and we are focusing our life on a particular way, and it is no distractions will affect us if we are properly practicing this thing. And the yogic definition of stress is uncontrolled and rewinding speed. It is a not controllable, and also it's a rewinding speed as a stress according to the yoga things. And you all know that stress is a speed and a yoga speed. Yeah, through the yoga, I'm always instructing my clients and my students is like it is yoga means from your restlessness to the restfulness in your state of also because of the time limit. I'm not providing any other practical things. And I was planned one more pranayama. It is called laya pranayama in my this session, but because of the time limit I'm not providing anything because we need more time to practice. This physical practice also important for the this thing. So one preparatory practice, you can check my Facebook page for more information about this stress management pranayama and breathing things included. So one more thing you can do is one of my latest upload is for the vertigo and ear balance thing. And you can check my Facebook page for the practice of this ear balance issue and the vertigo. We called vertigo, ear balance, and this thing. It's a simple eye exercise, a preparatory eye practice. You can continue. You can sit on a chair, and this is a detailed explanation of that thing. And I think that eye exercise need a practical mode. You can check Facebook page for getting more information about this vertigo and ear balance thing. Within this, I'm not going to any other further practical session of this thing because I hope I can conduct a direct class in Bharathiyar University. Come to Bharathiyar University, and I hope I can do a direct class, a more on practical oriented class for you in coming future. So with this, I'm stop this presentation, and I hope you all are listen it properly and try to practice this pranayama technique. And what I taught in this session, practical session, try to follow it in every day. You will get a big change, a drastic change in your life through this practice. And especially those who have any health issues, another health issues, you can freely contact me. And I'm training for different issues and training for different health issues. So I think it is time to conclude my session. I'm very, very, very excited, and it is a dream come true for me. It's a dream come true today to conduct any sound disturbance, sir.
No, no, no. Go ahead, go ahead.
Yeah, we can hear you, sir. Please go ahead.
Yes. it is a dream come true for me. It is more privileged, and it is like I'm deeply honored today to present in front of my professors, and especially that Velayathan sir, that without tell a few word about Velayathan sir, that my thing will not be over. Velayathan sir inspiration is has the highest level of inspiration. I still remember his final that motivation during our end semester or final semester in during my MSc period. He inspiring like okay, you should move forward, or you should be more brave and be courage in your ability, and be move forward, and be trustworthy, and be more courage in your activity, and be bold in your activity. Otherwise, you don't tell I'm a student of Dr. A. Velayathan. I still remember his inspirational way. That strikes me a lot, and I remember that remembering that things. And of course, Analakshmi ma'am, no need of any inspirational word from Anna ma'am, because ma'am each and every moment in the Bharathiyar University, she is inspiring in her each and every activity. Such a talented, such a highly achieved every successful field in her life. She is, and of course, Krishna sir, he was my guide in my end semester, my project. He helped such a lovable person, such a person with. We enjoyed his class with a lot of fun and comedy, and it is really missing my colleagues and everyone. He's ready to be enjoy everything with us. He like a student. He is enjoyed with us, and those time I still remember a lot of life experience from the Bharathiyar University, and their guidance and their motivation that make me what I am today. And I believe I believe and I hope I can come to Bharathiyar University for a direct presentation, for a direct class for all. And I'm thank you to all the research scholars on that time. They are all also motivated with the different information and everything. And hope I don't miss anyone. And my colleagues, my fellow colleagues also, they are doing a PhD program. They help me a lot with updating information from Bharathiyar University, especially the research scholars, Anjo and Akshaya and Shilpa. They are all give me the updation of the changes, the upcoming changes of Bharathiyar University. So it is helped me a lot to be in touch with Bharathiyar University. So I'm very thankful, and it is my dream come true today. Thank you all. Thank you all for inviting me to this session.
Thank
Okay, over to you, sir. Over to you, sir.
Okay, Amal, it was a
Yes,
wonderful.
sir.
Right? It was practical, and also how the way you explained, I was astounded, right? Because
Yes, sir.
confidence you was for talking, right? The body language you exhibited, wonderful, right?
Yes, sir.
I expected this, and I'm so proud of you people, right? Especially Amal Abraham. You've come a long way, and you'll go a long way. My best wishes for you having contributed to our department. And I think, as you wished, that you would be able to come August after August 15th. We are getting our new drug. India has produced already for COVID.
Okay.
Going to be released very soon, after August 15th. And then we will meet. You can come and talk to our students, right?
Sure.
By the time freshers will also come, you can also join us. Thank you very much for having accepted and also be part of online to online. And you did a very good job, right? Yes, very good, very good. Yeah. Congratulations. Keep it up, right? My best
Thank you
wishes.
so much. Thank you so much.
Akshaya?
Yes. It was very informative session, and you can go and see in the YouTube. There are a lot of comments, positive comments for your session.
Okay.
Yeah,
Okay.
it's really nice. But we missed out due to the time constraint. We missed out most of the practical
Yes.
suggestions that you are giving, techniques you are giving. But it was a
Yes.
combination of physiology, psychology, and yoga. I really
Yeah.
appreciate that you gave us simple practical yoga techniques as much as possible to practice in our day-to-day life. It was really wonderful.
Yes.
Thank you so much. Now I request Professor A. Velayathan sir Professor and Head Department of Psychology, Bharathiyar University, to share few words and deliver the vote of thanks.
Okay. Thank you, Akshay. Amal Abraham, I should thank you because you are online, and also I would also thank Dr. Justin James and Ms. Priyadashini for having contributed to the department, right? And we want to see that our alumni shine, and you are one among the stars, right? The 3 stars already consecutively past 3 days have been shining, and it's very we are very happy and also thrilled to see that around 1,700 hits today also on your YouTube, and the people are still there, right? They are not left the screen, right? So it shows that how much you people have grown, right? I'm so happy, and also I'm happy to announce that in another week or by another week, fortnight, we will have one more program on statistics using SPSS. One of the alumni will join. I announced, yes, that's a good sign of which making up for our department's growth. Thank you very much, one and all, for having being part of this, especially my team members here in the department, and also my son Gautam, who was able to help me through those online YouTube and other facilities and designing the certificates. Moreover, the last but not the least, the participants. There are 1,700 participants who are viewing this online, and since it is in YouTube, there will be many more viewers, I believe, right? And it has been a contribution by us, especially Department of Psychology, to the society. Hope it remains there and people cherish this and get a benefit out of it. And so happy that we are all able to contribute to such a wonderful society. Thank you very much, sir. Bye. Bye.
Bye. Bye.
Thank you.